Hi, I'm Lori Kane from the Center for Cosmetic Surgery and Medi Spa, the plastic surgery office of Dr. Dean Kane in Baltimore. So I'm here with one of our favorite patients, Millie, who has returned to do a secondary type of facial procedure. 2 years ago, 2018, Millie had a full face and neck lift, and then she decided 2 years, well, I'll let Millie tell you when she decided, but she decided that she wanted to complete her facelift and do a brow lift. And on top of that, she said, I want a lip lift. So we're going to show you what I'm also here to talk about is people always want to know, what do I look like right after surgery? This is Millie's 3-week post-op. So she had the brow lift 3 weeks ago. She also, on top of that, we did a chemical peel, a TCA chemical peel to smooth out her lower lid. So she had a complete brow lift. She had TCA chemical peel. Oh, and Sculptra.
Yes.
How could I forget the Sculptra?
I know, exactly.
So my favorite procedure is Sculptra. So to maintain a facelift, we use Sculptra to keep your face constantly stimulating collagen elastin. So she went for broke on this one. She did a brow lift. She did a chemical peel under her lower lids. She does an annual Sculptra treatment to keep her facelift firm and tight. So she had Sculptra during this procedure, and she had a lip lift. So I'm going to now put my mask on so that Millie could take her mask off. I'm trying to keep very COVID safe here. Okay, so Millie, show everyone.
Okay, so yes, after the face and neck lift, which I love and I still love, I decided what would really complete it was 2 things: a lip lift and the brow lift. The brow lift was quite obvious because even with using Botox to help elevate my eyebrows, I would still have like a fold of skin here, and I still had like, I don't know, it felt fat here. And no matter what, you still get lines here with the Botox. So the brow lift like stops all of that. It's perfect. I love it. Even if I'm still healing, I can put a scarf on, you can't see it, and I still look normal 3 weeks. The lip lift is just phenomenal. I love it. You can, it was a piece of cake. The whole thing actually compared to the neck lift and the face lift, for me, the brow lift was easier. The healing has been faster, I feel. It was tight for the first week, but now it feels normal. At night, it's mainly during the night, not during the day, but mainly at night. I feel the pins and needles. Last night, believe it or not, it was like acupuncture. If I'd ever experienced it, I go, oh, that's what it would feel like. But it's not the end of the world. You don't have to pop a pill.
How about the headaches? Did you have headaches?
Oh, yeah. The headaches I was warned about, and I did. Starting from day 1, I had a headache. And that is because of the tightness. The other thing is up in here, I'm numb still, and it felt like I'd worn a too tight ponytail. And now that doesn't feel like that anymore. But the headaches, probably, I want to say within the last week, have stopped.
So you had the headaches for about 2 weeks.
Yes.
Yeah.
Yes, and it wasn't like the first couple of days, the headache was more in terms you took 2 Tylenol and you laid down and you made yourself go to sleep. And then the headache went away because you were sleeping. And I really didn't have a hard time sleeping either. It's sitting up is harder to sleep because I'm used to sleeping like this, all scrunched up. But to have to sleep like this, straight up, or like leaning back on the sofa, so to speak, that would be hard at first. But once I fell asleep, I was asleep. I was done until the next morning. So,
yeah,
I mean,
it looks beautiful.
I'm really happy with it.
Yeah, and under your eyes are nice and smooth.
Oh yeah, the chemical peel. I mean, in the beginning, because I took pictures of myself. But in the beginning, It was a mess.
I got a lot done. The bruising coming down the face.
Right. The bruising, now I'm just like a green color, which actually green is easy to sort of make disappear with a little cover up. And, but I had a black eye. My mother came in the living room like a day later and she goes, "Oh, you have a black eye."
Just the one side.
Yeah, just the one side, which was pretty funny. And, yes. There are sometimes like if I touch too hard, I can feel a bruise. I feel tenderness, but it's, again, it's doable. It's not, like crying, so to speak. It's just like, oh yeah, don't do that.
So what made you do the lip lift?
Okay, so the lip lift, believe it or not, on Real Self, I saw another woman who at the same time I was doing my face and neck lift, she was doing her face and neck lift down in Texas. So we were talking back and forth. And the one thing she decided to do was the lip lift. And I was just amazed at the difference it made when this gets pulled up, how some of us, like me, have, like, this looked even more elongated. And it really bothered me. I mean, that probably from the get-go bothered me more than this, because this I could fix with Botox. This is what it is. Fillers weren't going to help it. Chemical peel wasn't going to help it. The only thing that was going to help it was getting rid of the excess skin. The whole reason I needed the facelift, and that might have been why that this was so bad, was because, I went through a major weight change. I went from, like, I gained 80 pounds to I lost 80 pounds. And I did this within a 10-year period, so to speak. So my skin didn't bounce back. I mean, it really sagged bad. So probably this was a consequence of that also. So that should tell everybody, watch your weight. I mean, I did my own self in, so to speak. But
this looks so natural.
It does.
It looks like, and you can't even see the scars.
Oh no, that's the other thing. It's like this healed up. This healed up within a week and a half before even. By the time I came back from my 2-week visit, just a little bit of redness, but that's not a big deal.
Yeah, the scars are just really just around the outside crease.
But and it's up inside
the
right.
nose.
Dr. Kane was able to get up inside the nose.
Yeah, the
so
nostril, and
right,
just
yes.
along that base.
Yes, just here. But again, it's teeny tiny. The only time I can see the scar is if I use, what we should never have, the 10x mirror, and then I can see it, but barely. So that was amazing.
Yeah,
amazing.
You look sensational 3 weeks post everything. With the sculpture and no bruising.
Oh yeah, the sculpture is the best.
Yeah, sculpture is how we keep our facelifts tight and firm. It's an annual process of maintenance where you just use your Retin-A for the outside skin to stimulate and exfoliate your dead layers all the time, and that's the outside. And then underneath, we use sculpture to stimulate your collagen elastin from underneath. So you're doing both, and you're constantly maintaining, you're stopping the aging, reversing the aging, and you look beautiful all the time. So we know how to do it here.
Exactly, you do. And here's the other thing that's a little bit different. This time around, when we discussed this in August, that this was what I was not going to let another year go by. I wanted to get this done. And so the only thing that I really had to do differently this time around was, because I do use the ZO skincare line, I do use the Retin-A, I had to put the Retin-A up into my scalp line and up into my nose, okay? And I did this religiously. Starting in September, when I slowed down working outside, I started doing my Retin-A. And I think because I can't get over how quickly this healed for me, much faster than this healed. I just think that using that combination.
Yeah, we're a big believer that Retin-A brings blood flow and provides greater healing. So we always like to get all of our surgical facelift patients on Retin-A before their surgery, because it aids in the healing and the rapidity of how fast your skin responds to the surgery. Yeah, so, and just to put a plug in for Millie, Millie is our landscaper, and she does gorgeous, gorgeous work.
Thank you.
So if you're ever looking for an amazing landscaper, that's Millie Troy.
On the word.
Yeah, she's the one. All right, well, stay tuned for our future pictures of Millie. We'll keep you posted as we progress 3 months and 6 months. We'll keep you in the loop. All right, give us a call. Dr. Dean Kane's office, 410-602-3322. We'd love to take care of you.